I had this case where I've been calculating the lens choice for a patient who's wanting a multifocal intraocular lens after cataract surgery, and the Pentacam showed no cylinder, so 0 diopters of cylinder, whereas the Eyewall Master 700 showed 0.75 diopters of cylinder.
Yeah.
So I've chosen, so initially if you didn't consider the Eyewall Master, you would have just looked at the Pentacam and put a non-toric in.
Yeah.
But I used the Barrett formula and I put in the PC posterior cornea values from the Eyewall Master 700, as well as the Pentacam Ks, and that's come back as a T2 toric, and we'll be aiming for emmetropia for this patient, so that to give them the least amount of cylinder, and that makes the multifocal lens work the best.
Yeah.
Have you ever dealt with this situation before?
Not really. Like maybe usually the Pentacam was like flat. Not flat, but like no sill, that wouldn't do anything.
Yeah, exactly. That's right. That's what as a registrar you you rely on the Pentacam. But now it's really important to think about posterior corneal cylinder.
Yeah.
Because that can affect your result.
Yeah.
Especially after a multifocal lens, which is very sensitive.
Yeah.
So I thought that'd be a good case to talk to. Yeah.
So did you? Oh, sorry. Did you use like the Barrett True K?
Yes, I used the Barrett True K formula,
Yeah.
as that gives you the best outcome, and it takes into account these other aspects. It really helps when you're using these premium lenses.
Yeah. And you use the case from the Pentacam and not the Eyewall Master?
Yes, I prefer to use that just because it gives good imaging of the front. I've used both, so posterior cornea as well as the case from the Pentacam.
Yeah, because on the Barrett True K you can enter like multiple.
Absolutely. So it's a really good formula to use.
Good. Perfect.